The challenges and opportunities made available through the new healthcare reform law are enormous. The new healthcare law presents tremendous opportunities for greater access to quality, patient-centered care, the kind of care PAs have been committed to since day one of the profession. An estimated 32 million Americans, think about that, 32 million Americans will now have access to care. 32 million that were not in an already strained system before this law was enacted. Through new data collection, subsidies, insurance market reforms, and health promotion and wellness provisions, the new law tackles health disparity, economic disparity, and lifestyle choices resulting in chronic health conditions which plague an increasing amount of the population across the country. The use of evidence-based medicine, the expanded use of primary care and coordination, and new models of care hold great promise for controlling healthcare spending. AAPA's President-elect, Patrick Killeen, will address some of the challenges we're going to face as PAs as we begin to look towards implementation of the healthcare reform law. I want to acknowledge and offer very special thanks to the Government Affairs and Reimbursement Committee of the Academy, which has been chaired over the past year by PA Jim Carney of Rhode Island and several members of his committee. Together, the Government Affairs and Reimbursement Committee and our stellar federal affairs staff have made certain and have settled for no less than PAs being at the table as very important decisions were being made about the future of our nation's healthcare delivery system. Although we've made great strides in establishing PAs as key to any successful healthcare reform, we need to face that we're far from being instantly recognizable to all constituencies in the federal legislative arena. In that regard, over the past year, we supported our lobbying efforts for the first time with paid advertising directed specifically at Capitol Hill. Some of you may have seen the ads we ran on Capitol Hill or in what we call Inside the Beltway publications. If not, they're available on our website at aapa.org, and on the slide here you can see some of those. These ran in publications such as Roll Call, The Hill, Politico, Congressional Quarterly Daily, publications that legislators and their staff read and look to every day. They were very successful in getting positive attention for the profession among thought leaders, policymakers, and their staff. Our efforts to educate policymakers about the importance of the PA profession were noticed by officials at the highest levels of government, the very highest levels. Leadership of the Academy was invited to the White House on several occasions for meetings with administration officials charged with leading reform efforts. And often those calls come, as my assistant and other staff at the Academy know, we receive those calls at 3 o'clock on a Wednesday saying, we need you here at 1600 Pennsylvania Avenue by noon tomorrow, hope you can make it. You don't get a lot of notice, but we've been there, and I am greatly appreciative of our leadership's efforts, who with very little notice have been there to advance the interests of your profession and the patients you serve. PAs were invited to 2 White House events related to final passage of healthcare reform legislation. A rally for healthcare reform professionals, during which AAPA President Steve Hansen appeared on stage with Mr. Obama, and a bill signing event that was attended by President-elect Patrick Killeen. That sort of recognition would not have occurred if it were not for your efforts and the efforts of PAs back home who really committed to being advocates and to making their voices heard through every means possible. PAs were invited to participate in discussions and ask for their input at the White House and Capitol Hill with lawmakers on both sides of the aisle in both the House and the Senate as legislation was being drafted. And that input made a difference. The impact of the new federal healthcare reform law will be significant. As we've discussed, more patients will be insured, As such, it's only reasonable to expect many, many tens of millions more patients seeking patient care. This will put a strain on an already strained healthcare system and a strain on the supply of healthcare providers and necessitate a much greater commitment to teamwork across the healthcare delivery system. The good news for PAs, this teamwork business isn't new to us. This is not a new phenomenon. We don't have to get used to it. We really invented it when you think about it. The number of clinically practicing PAs is projected to top 100,000 within the next 3 to 5 years. As Steve noted, the profession is growing rapidly, and as the numbers grow, so does the strength of the voice that represents the profession. AAPA will continue to impress upon PAs the need for awareness on the issues that impact the profession. In addition to healthcare reform, which obviously was a major component of our legislative agenda this year, we also had some other important work that we were doing on the legislative front that I think is very important for you to be aware of. AAPA continued its work in partnership this year with the Veterans Affairs Physician Assistant Association. Together, we worked to engage members of the Veterans Affairs Committees of both the House and the Senate in support of a bill establishing a full-time director of PA services at the Veterans Administration Central Office. AAPA Vice President and Speaker of the House, Bill Fenn, presented testimony to Congress. In signaling yet another milestone in our advocacy efforts and achievements, I'm very pleased and proud to report to you that the bill establishing a full-time director of PA services at the VA was signed into law on May 5th this year. That bill is part of the Caregivers and Veterans Omnibus Healthcare Services Act of 2010. And my great thanks again to our partners with the Veterans Administration, PAs. They've been great partners. We've worked on this really for far too long. Our voice is now louder and more powerful, and our hope is in the future these bills will proceed at a more rapid pace. Let's transition to state advocacy for just a moment, because let's face it, all politics are local, and it's actually at the local level and the state level that legislative efforts impact day-to-day the practice environment in which you provide patient care. AAPA's state advocacy plate will also be full in the future, as it was this past year. Since last year's conference in San Diego, PAs in 32 states and the District of Columbia have worked with the Academy on improving state laws that govern PA practice. Efforts to authorize or improve PA practice are also underway in Puerto Rico, the American Samoas, and the Commonwealth of the Northern Mariana Islands. There are PAs there. State laws and regulations governing prescriptive authority for PAs have improved, and PAs may now prescribe in all states in the District of Columbia, and that authority includes controlled drugs in 48 states. Let me share with you just a few examples of the many accomplishments in the state advocacy arena in this past year. Some examples include 6 states increasing the number of PAs physicians may supervise, and in North Dakota, they removed the ratio restriction completely. 4 states passed legislation authorizing PAs to take x-rays or use fluoroscopy. 3 new state laws authorize PAs to provide care in disasters. 2 states passed laws authorizing PAs to join with physicians in the establishment of professional corporations. States are also busy, as we speak here this morning, writing language favorable to PAs as they enact their own healthcare reforms or plans for state implementation of the federal law which has been passed. The majority of states that have established medical home pilot projects have included PAs at the forefront of those projects. Our goal in all of our advocacy initiatives, whether on the national, state, or local level, is to provide you with the best possible legislative and regulatory environment within which to deliver patient care and to recognize the profession as a principal player in the new and emerging healthcare paradigm for the country.